All right, so I'm going to talk about thiazide diuretics. So, our prototype for this one is hydrochlorothiazide. It is a mouthful, and it's shortened to HCTZ. The pharmacokinetics for this drug this is administered orally. And it accumulates only in the kidneys. Diuretic effects occur within 2 hours. Peak at 4 to 6 hours. And lasts 6 to 24 hours. So, the mechanism of action for this drug is it decreases the reabsorption of sodium, water, chloride, and bicarbonate. It is used to treat edema associated with heart failure, the book also does list mild to moderate hypertension, but as Professor Miller stated, we will not use this for hypertension. Other drugs in this class include chlorothiazide, or its brand name Diuryl, chlorthalidone, indapamide, and metalizone. So for older adults, should be noticed that they are increased risk for adverse effects such as decreased BP and electrolyte imbalance. So, and then we go to patients with renal impairment. The effectiveness decreases as the GFR decreases. Hepatic impairment patients, they're at an increased risk for thiazide induced hypokalemic and hypochloremic alkalosis. Adverse effects. Hypotension, so decreased blood pressure, weakness, dizziness, diarrhea, constipation, and electrolyte imbalance. Contraindications. Sensitivity, known sensitivity to hydrochlorothiazide. Anuria, or not peeing, no urine output. Nursing interventions. So we're going to look first at interactions. So drugs that increase effects, alcohol, barbiturates, opioids, beta blockers, digoxin, corticosteroids, and then we'll go to the drugs that decrease effects of hydrochlorothiazide, and methylphenidate, NSAIDs, administration, So we need to note the ceiling dose of this drug. And the ceiling threshold is a certain dose that yields a near maximum diuretic response. It is dependent on the type of diuretic and the extent of a person's disease. And then it's just when the diuretic dose is less than at the ceiling, fluid retention remains following diuresis, so urine. In adults, max daily dose is 200 milligrams. Assessing for therapeutic, so assessing. So we'll have decreased edema. Tinnitus is an adverse effect. Dizziness. Teaching. Taking medication as prescribed. Follow-up appointments. Signs and symptoms of adverse effects. And that's it. That's all, folks.